Hi, my name is Rachel Yang, and my mentor is Cecia Sanchez. Welcome to my presentation on demography and COVID-19. I chose to center my project around economics because of my interest in labor dynamics and public policy, and I am currently presenting from San Mateo, California. So, in my research, I examined the impact of the COVID-19 recession on the health of the U.S. economy by measuring changes in annual GDP per capita. Through designing and analyzing two linear regressions, I aim to build upon existing BSL models by examining how the percent share of workers belonging to different age brackets contribute to GDP per capita in different capacities. Then, I also look at how each age bracket's corresponding annual per capita deaths correlate to GDP per capita, specifically comparing the coefficients of younger age groups with older age groups. Through these two regressions, I sought to gain more insight into how people's economic output changes throughout the course of their life, as well as how medical resources can be more effectively allocated during public health crises. Currently, Viscusi's BSL estimates and other similar models have been used by the federal government to attach quantitative values to the hypothetical number of lives saved by public or private measures. In Goldstein and Lee's research, they found that while saving 20.5 million years could be valued anywhere from $10.2 to $17.5 trillion, other models were projecting values as low as $2.6 trillion. This discrepancy communicates the complexity of assigning a single universal value to statistical lives, where age distribution and employment status is not accounted for within the model. So, similarly to all-cause deaths, COVID-19 mortality is positively associated with age, prompting the US CDC to classify individuals 65 years and older as the vulnerable group. As visualized by the graph on the right, COVID-19 overall reflects the Gompertz law, where the rate of mortality exponentially increases with age. Accordingly, since the older population was disproportionately affected by COVID-19, many older workers were not only contracting fatal cases of the virus, but were also retiring at a quicker rate due to health concerns. This caused the number of retirements during the COVID-19 pandemic to exceed initial projections by almost 2.4 million, causing drastic changes to age demography and the capacity of the labor force. Like I mentioned earlier, I have designed two linear regression models as a part of my research in order to build upon existing knowledge on how the percent share and per capita deaths of different age sectors contribute to the health of the economy. First, I determined the different age brackets that would be a part of my regression. Since I am specifically focusing on people's economic output, I started with age 16, the average legal working age, and went up by increments of roughly 10 years from there. In doing so, I created the six age baskets as listed to the left of the screen. So in both regressions, I quantify the health of the economy through changes in GDP per capita, making it my dependent variable and regression output. Likewise, in both regressions, I held my control variables constant, attempting to eliminate the influence of any extraneous variables. First, I set year B1 as a continuous control variable in order to track changes over time. In addition, I take a difference in differences regression approach by setting COVID year B2 as a binary indicator variable, using 0 and 1 to identify if the regressed year is 2020, the year of the COVID-19 recession. In doing so, I isolate the discrepancy in GDP per capita that occurred specifically during the recession year, denoting that the significant decline in economic output is inconsistent with the overall trends of previous years. Finally, I also set unemployment rate B8 and savings rate B9 as control variables as well, attempting to account for the influence of consumption and labor trends that were also attributable to changes in GDP per capita. In my first regression model, I examined how workers between the age of 16 and 64 contribute to GDP per capita in comparison to workers aged 65 to 100. In order to do so, I set my treatment variables B3 through 7 as the percent share of US workers from each age basket, ranging from the year 2000 to 2023, which gave me a total of 24 observations. Then I set the age bracket 65 to 100 as a dummy variable by omitting it from my regression entirely, thus meaning that coefficients B3 through 7 will all be relative to the coefficient of the share of ages 65 to 100. Then, in my second regression model, I align each age basket with the per capita deaths of the total population. Similarly to the first regression, I have also set 65 to 100 as the omit dummy variable, so that coefficients B3 through 7 will all be relative. It is important to note that for this regression, I can only find raw count population data from the years 2000 and 2007 to 2023, meaning that this regression is being computed with 18 observations instead of 24. So on the screen, I have my Gretel output for the first regression. As visualized by the table on the left, the negative coefficients for each share of age variable that range from 15 to 64 indicate that a 1% increase in the share of individuals aged 65 to 100 who are employed will increase GDP per capita by the highest amount compared to any other age group. Then, by observing the coefficient of the treatment variable, share of ages 45 to 54, we know that a percent increase in the share of employed individuals belonging to this age group increases GDP per capita by only $163,336 less than a percent increase in the 65 to 100 age group, making it the second most influential age bracket. From there, the same intuition can be applied to rank all the age brackets of the employed population from most to least influential, giving us the order to the right of the screen. So my continuous variable year has a coefficient of 2,779.91, meaning that each additional year can be attributable to an increase in GDP per capita by $2,778.91. This coefficient is likely attributable to the United States' growing productivity along with inflation. Then my indicator variable, COVID year, has a coefficient of negative 939.54, meaning that during a COVID recession year, GDP per capita will deviate below its productive value by $939.54. Savings rate has a coefficient of negative 195.05, meaning that a percent increase in savings rate will cause GDP per capita to decline by $195.05. Finally, unemployment rate has a coefficient of negative 80.98, meaning that a percent increase in unemployment will cause GDP per capita to decline by $80.98. So in many ways, the results from this regression seem to be capturing the immediate effects of the increased cost of living over the past few decades. One key effect of this phenomenon was the rise of short-term retirements, where workers would temporarily retire from their jobs between the ages of 62 to 65, under the assumption that their savings and Social Security would cover their cost of living. However, due to the rise in CPI, some retired individuals have found that they can no longer sustain themselves comfortably, prompting them to rejoin the labor force. And this can explain why the employed 55 to 64 age bracket contributes the least to GDP per capita, while the 65 to 100 age bracket contributes the most. Because a large portion of 55 to 64-year-olds are retired, the employed population is significantly smaller than the other age brackets, making each additional percent share of the 55 to 64 age sector less significant. Likewise, when older workers age 65 and up rejoin the labor force, they are not only the most skilled, but are also the most productive workers, meaning that their economic output will be inherently higher. So on this slide, I have my Gretel output for my second regression. As visualized by the table to the left, a percent increase in the per capita debts of the 25 to 34 age bracket will have the most detrimental effects on the economy, as indicated by the coefficient negative 7.17. This means that compared to the mid group, per capita debts 65 to 100, a percent increase in per capita debts will lead GDP per capita to fall by roughly $7.17 more. On the other hand, applying the same intuition, we can conclude that a percent increase in the per capita debts of the 55 to 64 age bracket will have the least impact on the economy because of its positive coefficient 6.56. This means that compared to the 65 to 100 age bracket, a percent increase in per capita debts of the 55 to 64 age bracket will cause GDP per capita to fall by $6.56 less. Thus, when we order the age brackets of the total population from being the most to least influential on GDP per capita, we can drive the order to the right of the screen. As for the coefficients of my control variables, it is important to note that while I am using the same controls across both regressions, the coefficients are slightly different for each one, likely because there are certain exogenous variables that my regressions don't completely account for. With that being said, the coefficients are still accurately representing more general causalities, with consistent positive and negative correlations, along with minimal variation between values. The results from this regression overall seem to reflect not only the employment demography of each sector, but also the overall raw count population and consumption trends, causing slightly different results from the first regression. Demography-wise, 25 to 34-year-olds make up the largest sector of the population, hence why a percent increase in deaths per capita is the most detrimental to the economy compared to any other age group. Moreover, it makes sense that the younger population as a whole is contributing more to the economy since they might be making larger purchases such as real estate, which all count towards consumption. In contrast, while individuals aged between 55 and 64 don't necessarily make up the smallest share of the total population, the combination of their lower employment rates and reduced spending habits can explain why they are the least influential to GDP per capita. So, in conclusion, the increased cost of living over the past few years have significantly shaped employment trends, specifically among the older population. Moreover, COVID-19 has also drastically driven up retirement rates, while also prompting companies to lay off younger employees with less work experience, both of which compromise the capacity and the health of the economy and labor force overall. This issue is highlighted by my two regressions, where the 65 to 100 and 25 to 34 age brackets are both indicated as key contributors to GDP per capita. Thus, from an economics perspective, it makes the most sense for public health resources to be prioritized to those two age sectors, since it would likely lead to quicker economic recovery. Finally, my findings also demonstrate the importance of factoring in employment status and income fluctuations when determining the value of a statistical life, especially considering recent events such as COVID-19, which have drastically reshaped the demography of the US labor force. So, before I conclude this presentation, I would like to take a moment to express my gratitude to a few individuals who made this presentation possible. First, I would like to thank my incredible mentor, Dr. Cecia Sanchez, for her invaluable guidance, expertise, and support throughout this entire research process. I would also like to extend my thanks to my economics teacher, Patrick Berger, whose guidance and encouragement has truly motivated me to pursue this research. And yeah, thank you so much for listening to my presentation.